Dr. Rob Streisfeld, Doc Rob. Happy to moderate this panel today. I'm talking about CBD for athletes. We have a great panel today, a lot of information, and of course, spending time at the end, we're going to give a chance for Q&A because this is what we're here for, education and interaction. We want to all leave with a little bit more insight to this amazing emerging category of cannabis, hemp, CBD, and all things related. So it's my pleasure to introduce our panel today. We got Dr. Lise Weyeback, Dr. Murdoch Kalhegi, is that close? Good. Close enough. Marvin Dagon. I'm all about it. I just get my name butchered Streisfeld numerous times, that's why I stopped. I just went Doc Rob, so I apologize. So it's a pleasure to talk. We're here talking about athletes. This is a big topic, whether it be from cannabis. I don't know if anyone saw the news recently of a professional athlete having his own experience on a plane with some, that's more THC, full edibles, but at the same time, for those that know, had he had a little CBD tincture in his pocket, he might have been able to calm down that panic attack and be okay. So we're going to talk a little bit about athletes and how CBD plays into that. There's a lot of areas. So one of the things, so I'll give a chance to everyone just to introduce themselves and their relationship to the subject matter. Dr. Merck, would you mind jumping in and saying hello and your background?
Certainly. So I'm Dr. Murdoch Kalhegi. I'm an emergency physician by training. Years ago, I also started launching various biomarker testing companies, specifically that focused on high-end athletes. Over the last couple of years, I've gotten fairly intimately involved with the CBD space, and I'm a senior medical advisor with Elevate Hemp.
So I'm the guy with the really long name up there, so Rick is easier. So my background is very convoluted, but long story short, U.S. Navy vet. I went to Naval Academy where I played Division I ice hockey. Had a few professional contracts, but decided to go the academic route. Ended up doing my training in neurosurgery, neurotrauma, spine trauma. After my wife got sick, I decided to stop practicing neurosurgery, so I live about 2 hours south of here. I practice exclusively cannabis medicine. I've been involved with basic translational and clinical research involving neurosurgical applications of cannabis therapy since 2005. I'm the CEO of Industrial Hemp and CBD Company in Georgia, and we're also going for our medical grow license there too.
I'm Marv Dagon. I am a retired professional athlete. I played hockey for about 10 years, 600 or so games across pretty much every top league you can consider on a world size, from the US to Germany, Austria, Russia, kind of all around. So I have a kind of a unique experience or insight into the differences in healthcare practices across kind of that athletic landscape. Currently, I'm the Director of Athletics for AG Health, which is a health company, and I'm the Director of Veda Sport, which is a isolate-based CBD line. And we've kind of strived on penetrating that athletic market and helping them understand that this is something that they can have, as a safe piece to their, nutritional value, and that's kind of like the goal that I'm working on.
Awesome. So when I first started getting involved with CBD and cannabidiol, it was a lot of talk about CTE and NFL players with concussions and long-term damage as far as their activity. Same thing with hockey players, which we have a couple of hockey players, and that's obviously. Rick, what are some of the factors that we talk about with CBD and CTE, or some of the impacts from physical sports?
Yeah, so I see. We were actually talking about this fairly extensively yesterday in a course I taught. There's actually a number of factors. So in the immediate, there's a couple of things that happen when you have a closed head injury or a mild traumatic brain injury. You have an immediate cascade of effects where you have inflammatory markers that are released. You have a reactive oxygen species. So when you guys hear, antioxidants, blueberries have antioxidant effects, or this is antioxidant. What that means is that it attacks a negatively charged oxygen molecule. So that's a reactive oxygen species. So those things are bad. Well, those molecules are generated, and they start attacking cells, and those start breaking down parts of the neuronal wall. Long term, what happens is a process that's similar to the processes that start forming plaques and tangles in Parkinson's and Alzheimer's. So when you start giving compounds that stimulate, especially the CB2 receptor, they start reversing some of those processes, both in the immediate term and in the immediate process and in the chronic process. So we can actually start even destroying some of those tangles.
That's awesome. So basically, when I read about it, there's some obviously short-term benefits. So if you have right after the accident or right after you have an injury, there's some immediate benefit from CBD, but also in taking it long-term, especially an athlete who's having repeated injuries of this nature, there are some protective benefits and some long-term support benefits as well. That's great. Dr. Marwick, we were talking about, this is not, let's say, new that there are injuries, there's new that there's inflammation with athletes. This is looking at what role does it have in comparison to some of the more traditional drugs or alternative uses for these type of injuries?
Certainly. So a lot of times when I hear people discuss CBD, I hear it in the context of whether it's good or bad or helpful or not helpful. And that's not really how I think about it. I think about how does it compare to alternative therapies. So we know athletes, they get banged up, they get various injuries, tons of inflammation. They're already trying to deal with this in some way. So the most common modalities of trying to reduce inflammation and pain among athletes is anti-inflammatories of various types. You can have your non-steroidal like ibuprofen, Aleve, or even steroids like cortisone injections. The problem is all these therapies have negative side effects that are compounded for athletes. For example, anti-inflammatories can reduce the ability of ligaments and tendons to heal and can actually increase the chance of injury and rupture. It decreases your mucosal lining in your gut, and athletes already have impaired blood flow to the gut while they're doing their athletic endeavors. So this just compounds any injury to the gut. It reduces blood flow to the kidneys, which blood flow to the kidneys is already really important, especially when you're trying to maintain hydration. So these are the therapies that people are already using, whether it be taking pills or injections of anti-inflammatories or what have you. So I compare CBD to that. And CBD, we see a lot of that anti-inflammatory effect that are present in steroid and non-steroidal anti-inflammatories. But we don't see a lot of those negative effects. We don't seem to see a harm on the gut or a harm in wound healing or a decreased blood flow to organs. And so if I'm thinking about what's an optimal therapy in athletics, I'm going to focus on the thing that has less risks, less chance of damage, but can still provide a lot of that benefit.
That's great. Yeah, we talked about that these are issues, especially with gut health, especially with stress response. Like I've talked about this for my whole career, that if you have elevated chronic stress or cortisol, you actually get a thinned out lining of the gut, you get a weakened immune system, you get blood sugar irregularities, and not only does CBD affect, the inflammatory parts, but it also starts to support the body in its ability to handle and manage stress, as well as the overall digestive health, especially because the CB2 receptors are majorly, centered in the digestive tract in the gut area. So now we're talking about, it's interesting because we have hockey players on, and for most people that is the most violent sport, for the most part, except for this past week with football and helmet throwing. And I don't know if anyone knows what's going on.
They're just trying to be hockey players.
Yeah, well, they said that, I don't know if anyone knows that there was a whole big fight on the field with Pittsburgh and Cleveland, and they said that this guy crossed the line because he used the helmet as a weapon. It's similar, like you can hit people in hockey, but if you start swinging sticks around at people's heads, that's crossing the line, right? So, but when we talk about these athletes, there are inherent risks both in how they play every day, how they manage their body. This is their instrument, their the machine that they run every day. And one of the things you mentioned is your product line is isolate based, and I think this is important because I've always been a full spectrum whole plant advocate, and I was never a fan of isolate. I still have my concerns with isolate when it comes to regulatory landscaping and DEA and all that stuff, but as the industry grew, I became more familiar with why certain products should be or need to be at this point broad spectrum or isolate based. Want to go into some of that as far as from an athletic perspective?
Yeah, so, growing up, marijuana was like the taboo. Nobody wanted to touch it. And the understanding was that THC was this evil substance in a high amount. So that's just kind of across all landscapes, and the NCAA kind of dictates what most sports do because that's what athletes are groomed to understand. So as that landscape kind of becomes a little more dynamic and those, WADA specifically, as everybody probably knows, they removed CBD from the banned substance list in 2018. Not as loud as most people would have understood that it should have been said, but very quietly they also raised the limits for testing protocols. So now, like, I think Comcast is like 40 nanograms per milliliter, where WADA is 150 now. So THC is basically an out of competition supplement to some degrees in WADA standards. But again, it's about trust, right? So international standards, if you're caught with any trace of THC to that amount, it's a 2-year ban. And when you think of Olympic athletes, that's, that could be your career, that's it, over. So that's where you need to be able to help these athletes get to what's better for them. So there's a sustainable remedies for them, but they don't have access to the entire marketplace. So that's where an isolate is.
We should say without a TUE.
Right. Well, I mean, but that's right. We would love that to work in all cases, but unfortunately, like a therapeutic
Use exemption.
Right.
They're far and few between.
Unfortunately, there's been some cases with football players recently that for epileptic reasons need to take these things, and it's unfortunate, and that's where we are right now. The snowball is going down the proverbial hill, of course, but again, we need to be on the forefront of what change needs to be. So me specifically, I was part of a trial with Tyson Ranch. Dr. Damas is going to be by here. I think he's speaking at 2:30. Where we introduced CBD to former contact athletes, mostly UFC and football players. I was a young hockey player. But over an 8-week period, I saw a substantial change in voltage and millisecond response in my brain. So, to be able to see that is like part of that scientific proof of just a CBD isolate being able to have an effect and being, a half measure currently, but a step in the right direction, of course, I think.
I think that's great, and I think that there's a point there where, I would say that the majority of the industry, I'm not saying everyone, would be comfortable with a small amount of THC in these products, as most of the science and research is showing that even that minute amount of THC seems to make the whole product work better. But I do understand, and respect the idea that if you're an Olympic athlete, professional athlete, or anyone, we have military, we have pilots that fly, and they have that zero risk tolerance level, that at this point we have this option and this.
And it's for lack of understanding, really. It's not, and not necessarily even understanding. It's just for lack, and that's why I was part of that study. Is I really want to be part of that scientific answer. I don't want to be able to answer a question without conviction, knowing that I was part of this. I can say, this works. This is something that I visually seen. This is our study saw an answer that worked, and that's the piece that is we're in the process of obtaining now. So.
And so the physician that he's referring to, Hervé Dumas, so he and I work with the same nonprofit, Athletes for Care. That's largely Olympians, professional athletes, ex-college athletes.
Myself as well, and Rob in the back there.
Oh,
we're all.
So like Dr. Dumas and I see a lot of athletes. We take care of a lot of them. So I see a lot of professional drivers because they actually get a lot of chronic injuries too. So on the opposite end of that are a lot of the bigger name professional driving associations. So like the Indy Racing League, they don't want to hear a single utterance about CBD, THC, anything. They don't want to hear, and this is me talking on the phone with the medical director trying to even get a therapeutic use exemption for one of my drivers. He's like, I don't care. Don't tell me about the science. Don't fax me any, articles. Like if there's one accident, it doesn't matter. It's the optics. So, if that person tests positive for anything, doesn't matter if it was the other driver's fault. that's the only thing that's going to come up in an investigation. So.
I dealt this with, not in that same way, but we have, the medical community is, in most areas, is opening their eyes, their minds to this plant and the potential for these compounds. As I said before, about 4 or 5 years ago, we held an event in Navy Pier in Chicago for free for doctors, and the medical community, the associations in Illinois told them, if you attend, you're going to be penalized.
Yep.
This was a free event to teach doctors about this emerging category when they were warned against it. Now that state is now legal, and so those doctors wish they had that chance to learn years ago. And I think that this is something that we're seeing more and more. I've seen this with natural remedies outside of cannabis. I had one patient that was, a client that had an open wound. I gave him a natural solution. He went to his doctor. He said, oh, I went and got this, and he went like this. He goes, keep doing it. I don't want to hear about it, though. And they're still having this stigma with cannabis and hemp. And I wonder, Dr. Murdoch, is this, do you feel this is a little different in Colorado? I mean, that's where, in a place where it becomes, we've had pain centers in Colorado for years, and things of this nature, or is it still seeing the same kind of battle on the professional levels?
Yeah, so I live in Colorado, which has definitely been ahead of the curve of most of the country. And I would say what I've seen is medicine is still behind the populace at large, but now CBD and other cannabis-related products are so prevalent in Colorado, it's forced the medical community to catch up and be more aware. And by being forced to be more aware, they've come to see, oh wait, there's THC that has certain hallucinogenic properties as well as benefits, but then there's CBD that doesn't have any of those properties, meanwhile has these potential therapies. And partly they're having to get smart about this because they have so many patients now coming to them already taking CBD versus THC or both. And so they have to get smarter about it just to keep up. And so I think you're going to see those changes nationwide too.
Yes, it's okay. We can do some questions. We're here to be interactive. That's okay.
We're talking a little bit about the ability to recover and help them get better after. What about performance just in general? Like I know that Veda.
Veda. Yep.
Performance line where it's pre and post and things of that nature.
So for me, a lot of the conversations I have with athletes when you talk about performance, the first thing I would say is like performance anxiety. And that goes across all kind of, walking into a board meeting to walking in, going to play in front of 20,000 people. Right. So that's a really big thing that I think is something that, and you talk about just regular usage, improved sleep can affect so many different things along your life. So if you're able to affect performance anxiety in some of the top athletes in the world, well, what does that do? Does that make them more creative? Does that make them more durable? Are they more of themselves where they can play longer and better for their organization? So these are the things that we're starting to unlock when we talk about, again, performance anxiety. So performance, the science, of course, is there for that performance thing when you talk of training, kind of like that creatine boom type of situation. But what the very noticeable for me personally, where I get headaches or anxiety or things like that, that would be the first performance anxiety would be huge. Yeah.
So from a physiologic standpoint, the majority of changes that you're going to see in the human body are going to come from stimulation of CB1 receptors, which you're going to think of THC. You do get some physiologic changes from CBD, but they're not as drastic. Like you are going to get some inotropic changes, so the heart pumps a little bit harder. It's more of the heart is able to relax more when it's filling with blood, so it's not directly pumping more. It's just able to get more of a stroke volume, and the blood vessels are able to dilate a smidge more, but not as much as you would with THC. So overall, there is still some physiologic change, but I think it's more from the brain chemical change.
I think there's more like an additive, like it's you don't go to the gym once and you're fit. It's like that when you continue adding it to your supplement regimen, you'll end up being, I would think an elite human. You have an active system where you previously didn't.
I personally noticed I CrossFit regularly, going to CrossFit gym in South Miami, that I'm just, for lack of removing anxiety before my workout, and then just during the workout, lack of apprehension
It's the bioavailability of it is the key. So if you're taking it for an event, it needs to be able to be active during that event. So our pre-workout has arginine in it as well as an aqueous CBD formulation. So you're going to get that 30-minute kind of say boost. But it's just it's something to get your body active, right? As we've there are small changes in the moments that you take them, but if one of the main ones is performance anxiety, then that's enough for me, in most cases. And then the add to your regimen is where you're going to get a longer, term passive uptake of the, the positives.
I spent close to, like I said, 18, 20 years in the dietary supplement world and natural products. So for me, when I look at cannabis in general, and you see a lot, even now in California, there's a gym that's pro-cannabis. People are smoking or using cannabis and seem to be getting better workouts out of it. Either they seem more focused or whatever, less apprehension. But for me, I look at this, they talk about adaptogens, the different plants that help the body manage and adapt to stresses. And I think cannabis is definitely, I call it a clean adaptogen in that sense that you wouldn't look at just as right before an exercise as the only time it's valuable, but taking it on a consistent basis over several weeks or months, that you would probably see a long-term value or benefit from having this compound. I believe that in the long run, CBD will be part of a daily supplement regimen. Kind of like fish oil and omega and probiotics and multivitamins for the everyday healthy person who wants to maintain or improve their health. It doesn't always have to be reactive to an illness or condition or anything of that nature. So, awesome, good question. So there's a lot of those facets, in that regard of how does this apply before or after. I think that's great that we're talking about, short-term and long-term benefits.
Yeah.
And
What's that like vape? I mean, people vape for like that instant satisfaction versus a tincture, which is like, you gotta digest it, right?
Delivery system,
Right, so-
exactly, is a big factor. Again, some people will say that they want a small spike of THC, but then others say, I can't risk that, I can't add to my drug test. So to each their own, that's what the whole idea of personalized medicine. But one of the things I want to mention was that we all have that endocannabinoid system, right? And if we haven't had any exposure to these compounds for years or our lifetime, if you weren't, obviously aside from breastfeeding, this is going to wake up a whole part of your body that helps to manage homeostasis, helps to support the body's functioning. So I think that no matter what, there's a benefit there.
We had one right here on the left here.
Yeah, thank you. I'm looking at the right one. I own a series. I'm sorry. I own a series of physical therapy facilities, and I'm an exercise physiologist by trade. Got into the rehab side, so I do athletes, injured workers, and the elderly. I want to know, can we pherese CBD cream into the body? Use a phereser like we would, like ontophoresis, to help penetrate it through the body?
So, no.
I'll say just more generally, kind of in the context of when I was speaking about comparing to other anti-inflammatories, we're now very used to the idea of absorbing things systemically. You injure your ankle or you hurt your back, you take an ibuprofen. I think that's probably one of the biggest advantages of CBD. CBD seems to have much better topical absorption than traditional anti-inflammatories. I mean, you don't really get ibuprofen cream or relief cream. I mean, things like that exist, but they don't work very well. And menthol, none of it's very potent. But topical CBD seems to be very effective and get much better penetration. So that's CBD in general. I'll let you speak to the pheresis.
No, I mean, I think you hit it pretty well. It really has to do, at least as far as available evidence goes, with the affinity of the TRPV1 receptor to really almost any cannabinoid, but most commonly THC and CBD. It's both, so really any cannabinoid, because it's fat soluble, easily penetrates the upper layers of the skin. The TRPV1 receptor is has an extremely high affinity for these cannabinoids, and then even if you don't make it transdermal, it just tends to stay in the skin because it's fat soluble. When you do a transdermal formulation, it absorbs readily through the skin into the bloodstream. So,
Yeah, I didn't know if there was any benefit to that. It was this question that myself and some of my colleagues had, if there was any old school benefit. Years ago, we always used the freezer to penetrate through the skin. It just seemed to help our our patients recover faster.
I mean, you might know.
From early research on CBD topically, there's been shown at least 4 mechanisms of action from skin health and skin conditions. So there's obviously antibacterial, anti-inflammatory, antipyrogenic. There's a lot of these scientifically proven effects of CBD on the skin. A lot of these formulations that we're seeing now are taking some compounds, on the more medical side, DMSO, more on the retail side, menthol, or some of the other ones that pepper, capsaicin, things that we see in more traditional pain meds, and they're combining that with the cannabidiol and see the increased effectiveness. And that's the thing from a consumer awareness is you got to watch out and see what's really in these products. I'm seeing a lot of these topicals, even down to our major retailers like CVS, promoting hemp and pain stuff, but it has hemp seed oil, which has no phytocannabinoids, and a lot of camphor or capsaicin in there for the pain benefit. So there's a lot of those questions of what's really in the product. And then with that, I just want to add that what you'll see a lot, I think there's a challenge, especially looking at products, that referring this as hemp extract is a lot more legally compliant than CBD cream or CBD products. I'm just saying that because there's going to be more and more. I just read the USDA rules just came out. The FDA's got plans for rules and regulations. So there's a language here that we have to look at from a compliance standpoint until certain rules are changed. And right now you're safer talking about hemp extract that contains phytocannabinoids like CBD than you are saying it's a CBD product. Just so, even if you're talking to other people in the athletic community, you're safer from a regulatory or legal standpoint if you say hemp extract versus CBD specifically.
We've always played with endocannabinoid nutrition, which is kind of a all-encompassing term of, the endocannabinoid deficiency is an actual deficiency now, right? So if you're able to give nutrients to that system, then as a kind of another workaround.
Yeah, you're not treating a disease, you're providing nutrients for your body to do its own healing, its own performance, and it's all those things that the body can do. But if you're given the right tools, just like I said, I don't deal with diets and food, and I don't just say just eliminate everything. I also talk about what we put in the body to give it nutrients, to give it the power to move forward. If it's adding, not just subtracting. So very cool. Yeah.
I wanted to touch up on what you guys were saying. I wanted to touch up on what you guys were saying with topicals, now especially for pro athletes or even college. Sublingually we know THC, but with the cream, would that be something that they can take a full spectrum cream, or do we still don't want to mess with that just in case?
So, from my understanding, NCAA athletes are off limits.
Okay.
They in their wording for testing is THC and other related cannabinoids.
Okay.
So it's very vague, where they could, if you don't want to go up against them as far as that goes. So that's that. I would say any NCAA athletes should just stay far away from it.
Okay.
And then, but as far as testing positive topically, I'm not sure about that.
Yeah,
That's a tough one.
We're not testing for CBD.
Right? Yeah, they're barely testing for THC in some cases.
Okay.
So realistically, a true topical, not a transdermal, but a topical product should not absorb through the skin into the bloodstream.
Yeah.
Exactly what he said, I would
Right.
just not play around.
The reason why I'm asking is if we're selling the product and I want to, let's say, have professional athletes as, as an ambassador or using it, is it something that, would they feel comfortable being in as the cream being full spectrum, or should we just say, let's do isolate or broad spectrum entirely?
Well, we all have probably a statement of you risk, it's all
Yeah.
gray area
Right.
still, but I would always play in a safe area right now on that level. A lot of the athletics or brand ambassadors I'm seeing is from professional athletes or whatever are often retired.
Well, unless you focus on CrossFit or those
A sport or league that allows it.
Right.
Yeah.
Just a quick question, so I make sure I understand. So you say for college athletes, if it's a full spectrum, like a pincher, a golfer product, they can take it. Oh, I'm sorry. They can take it, and even if they get tested, they're going to be okay.
No.
Full spectrum is actually the opposite. So full
Okay.
spectrum will have a small percentage of THC, and at any percentage of THC THC, depending on the test, depending on the individual, depending on the diet. There's a lot of factors, or the product itself, which may not be accurately labeled,
Yeah.
could cause it to be a positive test, which is not good.
So which one?
So
Do-
college athletes are just off limits.
So it's better they don't take anything.
Yeah, just off limits.
Oh.
And if it's for like an epileptic situation, then they have to go through some serious paperwork to even start that conversation.
Oh.
There's numerous, JUCO
Okay.
college players that are just unfortunate situations.
And
Yeah.
they
Oh.
probably won't get it.
Right.
Good thing I know. My daughter's a college player, and I was just wondering, because she asked me the other day, she's like, Mom, this is awesome, but,
Yeah,
I know,
it's
talking about
unfortunate, that's why I said there are some roles where isolate, comes into play as a benefit, or maybe a broad spectrum if it's really got good COAs. The problem that, I don't know if you guys have seen it too, with the lab testing, is there's such a variation in the labs right now, in the lab testing. The studies that I think Rodale just came out with that said there's a 15 to 20% variance on the field, and I don't mean the sport field, I mean the growing field. So one crop's growing on 20, 30 acres, there's 15 to 20% variation in the percentage of the cannabinoids in that plant from the same genetics. And then you go to the labs, and you send those samples out, and then there's 15 to 20% variation in the labs on what their results. So you can send out same samples to 3 different labs and get 3 different results completely. And that's why this panel's great, is saying it's better off to not risk it at all, because you're still, even if you're taking a broad spectrum or something like that, you may still spike unintentionally.
Well, and we're going to get into an issue very soon with the youth taking these products, because
Oh, yeah.
now I'm in Naples, I'm in Collier County, and your kids are allowed to take it. Obviously, my daughter takes it. I mean, that's just, I think it's ridiculous that this is even a conversation. But what happens when this generation is now a college athlete? Now we have an issue. So we're forcing this conversation as we have groups like this talk about it and keep pushing the envelope. And eventually it's going to come to a head, and there's going to be a serious conversation that's going to flip the NCAA, which I believe will be what kind of flips entirety of sports, because that's a serious, governing body.
We saw that shift in just the way recently the NCAA with the paying college players or the rights to gain some revenue or
I
income.
think it's
from sponsors.
fantastic.
That was a huge shift in policy that was long overdue. And this is, like I said, very good that the NCAA would probably be the gatekeeper to letting it become more available in other sports.
Do you think that hemp's cousin, the cannabis side of it, right? So when you think about that, when federally, because I believe medical cannabis will become legal, do you think that's why the NCAA, because there's still the stigma of it being federally illegal on the marijuana side, that's preventing them from, even though the Farm Bill has signed off and all the byproducts of hemp, it's the cousin that's causing the issues, right? So do you think that would change with the NCAA if that became federally legal? Just an opinion.
I think it's just the old guard that runs the NCAA. I think as management turns over and people move on and new people take over, I think that better thought and more forward-thinking conversations will happen. And that I don't know if I think that the majority of people have been able to separate the two at this point.
Yeah.
Because these conversations are happening in these higher up areas. We're not hearing about what the results are, but you have to know that they're happening.
Yeah, so in A4C, the Athletes for Care, that nonprofit, we collectively wrote and sent a letter to WADA, basically demanding that they remove cannabis from their banned substance list. Their major protest was that it is not, how did they word it? It was not in the spirit of sport.
I have heard
And
that.
yeah, and our argument was, well, it doesn't take away from the spirit of competition. It doesn't it doesn't unlevel the playing field whatsoever. And ultimately, I think that's what the NCAA is going to fall back on, because there's no way of proving or disproving that. So that's, that they'll just be like, it's an argument that you can't win. So.
I mean, there's a ton of research going on right now, again, around the world, as more and more of these studies come out, safety, of functionality, of bioavailability. This is going to, shift the table completely. I think we're still in an early stage of this industry. Some doctors have been researching it longer than others and feel a little bit more comfortable with someone first getting in there right now.
I have an actual example for you. By law in the state of Georgia, there are 2 universities that were granted medical grow licenses. Like, again, written into statute. They don't have a choice on it because it's for research. Fort Wayne State University and University of Georgia. My friend is the PhD horticulturalist that's supposed to be in charge of that program. He was told by the Board of Regents, in no uncertain terms, will we at the University of Georgia ever grow cannabis for any reason. So, and they said, we don't care what the law is. That will never happen here. So that's really the mentality.
And that's who's running the NCAA.
I'm just dead serious. That's
No,
what it is.
but, yeah, that's,
So I urge everyone to, again, support, like, organizations like Athletes for Care and other of these organizations. We've done this with children and autism and epilepsy. It's just getting the word out there and showing that there's an interest and a demand and people want to make change or see change happen on those levels, and that's the starting point. You just got to make a grassroots effort.
Anybody on the panel, would you know, as far as what the structure would be if someone needed this outlet, would the process of getting a therapeutic exemption, is that what they have to do?
Is that the route they would have to take? It seems like there's a lot of question about NCAA, so if you have therapeutic, you're allowed to take this stuff. Is that possible for them? I know professional athletes you can, to kind of get around the WADA stuff, but is that something the kids in the NCAA have the opportunity as well, the channel?
So technically, yes. The way you get a TUE is there's usually a form you can download from whatever governing body there is. And that's usually something that the athlete would bring to their physician, or that it usually be like the team physician. And there's directions that's right on that that are right on that form.
U of A, right, and then they're absolutely not going to do this, absolutely not. If you're an athlete, you need this outlet.
So it depends what there's rules on that form. So it might say only by your team physician, or it might just say a physician. So the other professional driving associations that I was calling around to find out for some of my drivers, they said, no, we don't care. There's no forms. You can literally just write a letter that states, yes, my driver needs this, and then liability's on you. So.
And again, I think you mentioned earlier, just because there is a form and you fill it out and submit it does not mean they're going to accept it.
no, there's
Correct.
been several.
It's ultimately
yeah.
up to them.
Do
Yeah.
make the effort, keep submitting it, but don't be surprised if you get rejected.
Mhm.
And that's the takeaway from that one for now. Any other questions as we're running our last minute or two?